You have just arrived back home from a long day of class, only to realize you have contracted a grueling headache. To remedy your newfound suffering, you, almost unconsciously, consume the recommended dose of aspirin from a bottle on your desk. But have you ever considered why you consume aspirin with your mouth? As fellow humans, you've probably experienced physical pain in some fashion, and have also probably attempted to relieve that physical pain yourself with over-the-counter medications, usually oral medications. As an EMT with 2 years of experience, I can explain why these commonplace pain-relieving medications are taken by mouth. The reason why most over-the-counter pain-reducing medications are taken by mouth is due to their simplicity for the average person to use. For a medication to have an effect, it must first enter your body. Some common ways medications can enter your body are orally, inhalation, and injection. The first route I will cover is the same route I used in the example, oral administration. When a medication is consumed through the mouth, it is called oral administration because the medication is being consumed orally. It can be some time before a medication taken orally has effect. As you have probably noticed, the pain does not immediately vanish once you consume the medication. The reason for this is because the medication usually must make its way through at least part of your digestive system. According to the National Center for Biotechnology Information, the primary site of drug absorption is usually the small intestine. This means most medications will have to make their way into the small intestine before they can have an effect. However, this route is extremely common for over-the-counter medications because it is non-invasive and extremely simple for the average person to use. Some common over-the-counter pain-reducing medications you might be familiar with are aspirin, ibuprofen, also sold as Advil, and acetaminophen, also sold as Tylenol. Now that we've established a basic understanding of oral administration, we can compare it to other common routes of administration you might be aware of. Inhalation. A medication that is taken by breathing it in has an inhaled route of administration because you are inhaling the medication using your respiratory system. Medications taken this way have a fast absorption rate as the medication is delivered into the alveoli in your lungs, which quickly absorb and then distribute the medication into your bloodstream by the pulmonary vein. But what is an alveoli, you might ask? Well, I'm glad you did. Alveoli are the part of the lung responsible for the absorption of oxygen from the air. According to the National Cancer Institute, oxygen breathed in from the air passes through the alveoli and into the bloodstream and travels to the tissues throughout the body. After the alveoli absorb the inhaled medication, the medication is moved to the bloodstream where it can take effect. This route of administration has disadvantages, especially for periodic use, as it requires a device to administer the medication, typically called an inhaler, and can be at risk of bacterial contamination. This means inhaled medications are usually reserved for long-term lung diseases. Now that oral and inhalation routes have been described, we can finally move on to injections. You have probably been on the receiving end of a needle at some point, and whether the experience was pleasant or not, injections remain a staple route of medication administration. But why? Medication administered by injection can take effect extremely quickly, especially intravenous injections, which cuts out the middleman and injects the medication directly into the bloodstream. However, this route is not without some risk. According to the Nursing Times, not only is the intravenous route inconvenient, but it carries the greatest risk of any route of drug administration. Injections are an invasive route of administration, and it requires puncturing of the skin to deliver. This can cause infections if aseptic techniques are not followed, and is not a suitable route for the average person to use themselves. You are now aware of the basic processes for some commonplace routes of administration. We can now reiterate some key takeaways and compare them to the oral route of administration. The reason the oral route of administration enjoys popularity with over-the-counter medications is due to its simplicity of use and lower risk when compared to other routes. Although this list is not exhaustive, it should highlight the added difficulty when using other routes of administration. Next time you attempt to suppress that headache, you can be gracious for the convenience and ease of use of oral medication.